Hello, everyone. Again to our second talk for today on Sunday. I would like to say thanks to Hospice for sponsoring our session today. And remember to pop into the lounge, which you give you points to win our great prize of a $200 book voucher. Just before I introduce Hugh, just remember that every speaker we have today connects into Health Pathways, which is a great resource, local context. A lot of work has been put into creating these pages, so really well worth checking them. So I would like to introduce Dr. Hugh Seward, who I think most of us know very well. He is a GP and a sports exercise physician, and he works in Newtown. For 25 years, he was the club doctor for the Geelong Football Club and CEO of the AFL Doctors Association for 15 years. And in 2016, he received a member of the Order of Australia for his national contribution to injury surveillance and prevention in Australian football, which is a real achievement. So Hugh's major interest is the promotion of physical activity in the community, and particularly improving understanding and capabilities of GPs to encourage and motivate our patients in this area. He is chair of the Active Geelong group, which is a great group and a community-based organisation established to make Geelong the most active city in Australia. And I think they're doing some great work in that space. And he is part of the Geelong GP Activity Ambassador Group, conducting research to assist GPs in prescribing physical activity. So Hugh is going to speak today, prescribing physical activity in a few easy steps. So over to you, Hugh. Thank you very much.
Thanks very much, Anne, and good morning to everybody. I too acknowledge the traditional owners of the land from which I give this presentation, which is the Wadawurrung people, and acknowledge their leaders past, present and emerging. And we often say these words, but in the context of discussing health prevention, it does have added meaning because the Aboriginal and Torres Strait Islander peoples are overrepresented amongst those in our community experiencing chronic disease, and they must always be a particular focus of our preventative efforts. And thank you to West Victoria for inviting me to present today and for their continued efforts to promote health prevention initiatives across Western Victoria, and all the GP and other health professionals who contribute to these activities. Physical activity is indeed the magic pill in health prevention. And for all its simplicities and safety, it's often lost in our battles to understand the latest medication for diabetes or the new pathology test for rheumatoid arthritis. And our patients have become conditioned to be prescribed a pill, or have an MRI, or an operation for everything that ails them, as they expect us to provide their cure. And it can be a struggle to bring them back to the basics of lifestyle, physical activity and diet. So every now and then we need this refresher on why prescribing physical activity is important and why we need some easy tools at our disposal to assist with these efforts. What I'm going to talk about today goes through what is physical activity and why it is important and when you can prescribe it, and then go to those easy steps. But first, I want to go back to this focus, which was mentioned by Michael Kidd yesterday on the National Preventative Health Strategy and our focus on preventative health. And in the preamble to the federal government's call for the consultative process over the preventative health strategy, I'm quoting. They say in that preamble, look after your body and mind by eating well, being active, getting vaccinated, and avoiding risking behaviours like smoking and drinking too much. And they can prevent many diseases and keep you healthy. We want to enable healthy living through supportive environments. And a final mention as we get into this talk, nationally, 50% of adults and 2 in 3 children don't meet the physical activity guidelines that have been set nationally. I'm not sure how you've started your day, and I congratulate those who may have already been out for a walk or for a run or ridden their bike, but are you physically active? And do you meet the Australian guidelines? Because we know that doctors who exercise are more likely to recommend exercise for their patients. And if it's good for you, it's good for your patients, it's good for you too. But like lots of talks, we need to start with some definitions. And there's a lot of mix around the use of the terms physical activity and exercise. So just to put this in context, physical activity is a more general term which includes all movement that increases energy use, while exercise is more a planned and structured physical activity. So physical activity might include things like gardening or carrying the groceries in from the car, whereas exercise is more a planned activity. And then exercise itself was broken down into other parts. So aerobic activity, which we talk of, aerobic exercise, which you talk a lot about, involves those repeated and continuous movement of large muscle groups. And activities such as walking, cycling, jogging, and swimming, relying primarily on aerobic energy producing systems. While resistance or strength training, a term we use a lot, includes exercises either with free weights or weight machines or your own body weight or elastic bands. And flexibility exercises need to be included in this discussion because that involves that range of motion around a joint, and balance exercises which benefit gait and prevent falls. And we talk about Tai Chi and yoga, they've got great carriage in this space because they combine flexibility, balance and resistance activities. And I love this quote, and it sums it up. Those who do not find time for exercise will have to find time for illness. All our talks have a COVID context, and either anecdotal or evidence or some surveys that have already been done, and I'm sure there'll be much more convincing research that's particularly out of the UK with their large numbers about how active people, whether they were more vulnerable to COVID or got a less severe experience with their COVID infection. But during our shutdown last year, some active people did become more active, we know that. But we did find that the less active people actually reduced their activity levels, and the inactive in our community increased their sedentary time. And we're not sure what the long-term consequences are for those reduced levels of activity, but it does mean that we have to have a renewed focus about increasing activity levels. And why is it vital? It's a major prevention tool for chronic disease and cancer, and also an effective treatment modality, and can be used as an adjunct treatment, particularly with chemotherapy. So show me the evidence, you'll say. Well, we know there's established evidence for the heart disease, hypertension, diabetes, and a variety of cancers beyond, in fact, just breast and bowel. And more recent over the last few years, good evidence about the benefit of physical activity for both the prevention and the management of anxiety and depression and dementia. But I'm going to give you some new evidence talking about the role of physical activity in persistent pain, the gut biome, infections, and of particular interest to us all in vaccinations. So to recap, what are the health benefits of physical activity? Regular physical activity reduces your risk of all-cause mortality by 30%, cardiovascular disease by up to 35%, diabetes by 40%, colon cancer 30%, breast cancer by 20%, depression by 30%, hip fractures by an amazing 68%, presumably through the benefits of reducing falls, and dementia by 30%. And just to focus on the yellow box for children, we know that it is of great benefit across age domains, but just that second point down, an improvement in cognitive function, If we look at these green adult box, go right to the end and see quality of life and sleep. And then for the older athletes, the role of physical activity in falls, frailty, and just basic physical function. There's evidence, extensive evidence about the benefit of aerobic exercise at a cellular level and a biochemical level. It increases mitochondrial density and so on. You can see listed there, and our lung function, immune function, and cardiac output. But also regular training reduces our hemoglobin A1C and triglycerides, improves our blood pressure, and improves insulin resistance. And that high intensity interval training has also been shown to rapidly enhance skeletal muscle oxidative capacity, insulin sensitivity, and glycemic control. So there's good evidence for the benefits within our bodies of the aerobic exercise. But some people are surprised that resistance exercise, those strength exercises, has some similar benefits. Obviously, as it's described here, we know that it'll improve your muscle mass and body composition and your strength, but it also has benefits for mental health and bone density and those other aspects of biochemical and physiological improvement. These are the guidelines from the Australian Institute of Health and Welfare that in their publication in 2018, but are used widely. And if it gives you, and you'll be able to access these slides so you can see the benefits across the ages, but I'm just going to focus on the second one from the right in the normal adult population, at least 150 minutes over 5 sessions per week. So 30 minutes a day, most days of the week. Minimising and breaking up prolonged periods of sitting and including 2 activities a week within that scope of muscle strengthening. And then for the older athletes who make up a large number of our patient population, more generally just 30 minutes every day and be as active as possible and muscle strengthening. So I said I'd be able to provide you with some new evidence, that's more recent evidence of the effect of physical activity. So what about the effect on the gut biome? We heard from Tatiana yesterday how diet can affect the gut biome, but so can exercise. And one research paper, I can provide you with these references at a later time if you wish, but it showed that exercise can increase the anti-inflammatory bacteria and decrease the pro-inflammatory bacteria, so it can be advantage to us. What about the role in infections? Well, meeting the physical activity guidelines reduces the risk of falling ill and dying from infections by 37%. Physical activity strengthens the immune system and it elevates our immunoglobulin IgA. It increases the T cells that are responsible for alerting the immune system of attack and regulating its response. And what about vaccines? Vaccines have been shown to be more effective after physical activity. And an active person is 50% more likely to have a higher antibody count after vaccines. So what I'm advising my patients when they are planning to have their COVID vaccine is to do some exercise on the day that they're going to have their vaccine, go for a walk or what other form of regular exercise they enjoy. And what about its role in pain? We know there is an immediate effect on pain sensitivity during and after exercise, and this is called exercise-induced hypoalgesia. But exercise has been shown to be effective in conditions such as chronic tension-type headaches and migraines. And chronic pain conditions, those with that central or peripheral sensitization, like fibromyalgia or whiplash disorder and that chronic idiopathic neck pain that we really struggle with, can benefit from programmed exercise. It's important to point out, and when you talk to your patients about this, in the early stages, they may get some enhanced pain as they begin their exercise, but over time they must persist because it will improve. I thought it would be good to share a case study that I had from last week. A young girl who's a Year 12 student with a history of migraines and mild anxiety. And of course, during Year 12, not surprisingly, presents with an increase in migraines and increased in anxiety. And on questioning, the relevant background was that she had been previously active. She'd played soccer regularly up until the start of the Year 12 year and had gone to the gym a couple of times a week with her dad, but had ceased because she had to have more time to study. So my question to myself was, can physical activity or exercise or sport help manage her condition? Well, we know, and we've just heard, that exercise can be used to manage the severity and frequency of migraines. Physical activity can assist with management of pain conditions, but we've also know that concentration and learning has been demonstrated to improve immediately after a bout of exercise. And of course, we know that exercise can help reduce anxiety. So my recommendation was that time she'd previously spent, so the time spent resuming her soccer and gym and even walking with a friend will assist her migraine management, academic performance, and her well-being in excess of spending that time trying to study more. I'm going to take a step back from our GP world and talk about what the World Health Organization sees here. They've recognised that physical inactivity is a global problem, and they're trying to promote active people for a healthier world. And a bit like a goal for carbon emissions, their goal to reduce physical activity by 2030 by 15%. And if you go to the boxes on the right of the screen, we've got, we work in the yellow number 3 space, creating active people, because that's the direct relationship we might have with our patients. And we're constantly badgering the government to put physical activity higher in the priority, both at local council level, state or federal level. But we also have to consider that it's important to create those active environments, and new housing developments have to include spaces for people to be physically active. But more generally, we have to create active societies. And that's where I'm going to briefly touch on Active Geelong. And Anne mentioned my role with Active Geelong and the work that we're doing and the role that many GPs in Geelong area have been playing with this. And I know we're talking far beyond Geelong, but it may be of interest to hear what we're trying to achieve. And we're trying to create a city and a region that's the most active in Australia. And our priorities, we've worked really closely with the PHN, through the PHN, to create our Active Geelong GP activity ambassadors. It's a mouthful, but we've had a number of initiatives which I'll outline in a minute. But we're also working with small, medium and larger businesses, supporting and encouraging them to develop physical activity programs for their workers and employees. We've got a website which we're continuing to build so it can be a resource for all physical activity related programs that you can go to and find, and sponsoring community events. But our next initiatives, and I'll come to this in a few minutes, relate to disadvantaged communities, and we're exploring an initiative using an activity app that's associated with providing rewards, and establishing how we can work more closely with disability groups and work within mental health and child and youth. And a new aspect that we're working with a number of groups trying to promote cycle tracks for both recreation, for walking, running and cycling, and for commuting within our city. But GPs play that key role in health prevention. We've talked about these are my top 5 on preventative health, and you're aware of them all. And I've smoking, alcohol, nutrition and obesity, mental health and physical inactivity. And it's amazing how those bottom 3 are all interrelated, particularly how we heard yesterday from Tatiana, how nutrition has that great role with mental health, and physical activity has a great role to play in all of these, well, certainly in nutrition and obesity and mental health as well. But I mention that again here in my talk because when we talk about the power of the positive message, this is where the discussion about changing people's level of physical inactivity to become active can be a positive message, whereas sometimes we get a bit bogged down in being the negative naysayer about stop smoking and reduce your alcohol and don't eat this and don't eat that. So embrace the fact that you can be positive about promoting physical activity. So the GP can make a difference. The first point we know from national research quite a number of years ago is that the GP's voice is the most influential voice beyond other communications to promote physical activity. That message has been shown to last longer than other messages. Our GP ambassador group worked 2 years ago with workshopping on what were the barriers. And these are the barriers you know so well when we want to talk about physical activity. There's a struggle to have the full knowledge of how you prescribe and discuss physical activity. You don't have time. We don't have enough reference materials, and I want to address some of that. There's no incentive in the MBS system to spend time talking about physical activity. And of course, our patient expectations, they'd prefer just for you to prescribe a pill. We also did some research with our 26 GPs on what might be the enablers to promote the conversation when patients come into the clinic. And we looked at 7 different concepts, and we came up with work that's done using brochures or questionnaires handed out from the reception when the patient checks in, so they can do that whilst they're sitting in the waiting room and read them or fill out the questionnaire prior to see the GP was the most effective. A reminder, I'll keep coming back to this, our recommendation for physical activity, 150 to 300 minutes of moderate to vigorous activity, and I'll give you some tricks about how to measure that. Include 2 to 3 sessions of resistance exercise, and a reminder that flexibility training and balance is really good for older adults. This is a great brochure from the UK and their initiatives. I just want you to focus right in the middle. What should you do for the patient? For a healthy heart and mind, be active. To keep your muscles and bones and joints strong, sit less and build strength. And to reduce your chance of falls, build strength and improve balance. Well, you may wonder what the 7 dwarfs from Snow White and the 7 dwarfs have to have a role to play here as they're whistling and singing on their way to work. Well, here it is. What I use when we talk about physical activity with your patient, forget about the METs or the heart rate. This is specific for the patient's particular level of fitness. For moderate physical activity, go down to the bottom, you can only talk, you can just talk during the activity. Sorry, I'll go to the left. It's the sing and talk test. So for light physical activity, you can sing during that activity. But for moderate physical activity, you can't sing anymore. You can only talk. And if it's vigorous physical activity, you struggle to maintain that conversation. A great little tool to use when you're explaining. You want people to exercise to a level that they can't sing, but they can only talk, or if they have to walk up the hill, that they get to a stage where they struggle to maintain a conversation, and that is good. So here are those steps to prescribing physical activity. I want you to place a high priority for every consultation to discuss physical activity and use physical activity as a vital sign. And some of our GP computer programs enable us to enter some details, but they're really not very good. We need to do some work on that. Discuss the importance of physical activity. Identify for that person the barriers and the facilitators, and then make sure you've excluded the contraindications. Develop an acceptable plan, and then follow up and review in subsequent consultations. So let's discuss that a bit further. I want you to focus not so much on the active, but on the inactive and the less active. Simply congratulate those who are already active and encourage them to keep going. Here's the list of those contraindications, which are pretty obvious. And people don't need to have a stress test before they begin some physical activity and some exercise. I won't go through them. You will have a chance to read them there now, and they're fairly obvious. But you need to advise the patient that if they do develop new symptoms of chest pain or palpitation, dizziness or dyspnea, they should let you know. And during an acute infection, they should stop exercising. So you're struck with the reluctant patient. I don't like exercise. I don't know how to start. It's all so difficult. I can't afford to go to a gym. I'm too old for that now. I get short of breath if I hurry. How could I possibly exercise? Or I'm too embarrassed by my weight and shape. So you need to consider what are the strategies you're going to use and what are the tools you will need. So first of all, that approach to behavioural change. Medical students now are educated in motivational interviewing, and for those who graduated at the same time as me so many years ago, we had to develop our own strategies. And perhaps they might not be as efficient and as good as what our current medical students are being taught, but we have our own ways. We recognise the autonomy of the patient, and it's really a partnership between patient and GP. And we need to connect the change that's needed to what matters. Build motivation, resolve their ambivalence, and plan change. So I'm going to talk about new tools to assist. I've got a web-based resource called Moving Medicine to talk about, which has been it's a UK initiative which has now been Australianised by the Australasian College of Sport and Exercise Physicians. Talk about a Geelong activity app that we're about to release, and talk about the GP walking programs that started at just when COVID hit, and now we're waiting to begin again. So Moving Medicine. This is a screenshot from the web page, and I've opened it up to show a drop-down box for type 2 diabetes. So if we go to the lower part of this slide, it's about conversations. And a long conversation doesn't mean it's necessarily good, and a short one isn't necessarily ineffective. And this website breaks down the conversation frameworks with suggestions of comments and discussion pieces you can have into 1 minute, 5 minute or more minute conversation chunks to have a positive impact. So when you open this, there's a consultation guide there, and you drop it down and you can pick whatever condition may be suitable and relevant to this patient. And you can turn your screen to the patient, and for the 1 minute conversation, there's just 2 or 3
I'm hoping Hugh will come back if we give him a moment. Yeah, sure. Hi, everyone. I hope everyone's starting to move out of their chairs while Hugh speaks. I have. He's got me motivated. We're just hoping that Hugh will stop being frozen. We'll just have to be patient. I also note in the discussion forum, it's worth having a look. Katrina's put the link to the moving medicine on Hugh's slides. We've also got one of our delegates actually on her indoor trainer while she's listening to Hugh. So yeah. I guess we just maybe get off your chair and do a little bit of walk while we try and get Hugh back on. Yeah, so what do you think? Okay. We're just waiting on Hugh, everyone. Sorry. We've lost him completely, so he has to log back in. So we may not finish this, but we'll see.
Oh, I'm sorry. which one it was, sorry. Yes. All right, okay. That one? Thank you. Right. Thank you, everybody. Thank you for your patience. I'm told that this is where I lost you all. And so I was talking about this new website, a tool that you can use for your discussion with your patients. And this is Moving Medicine, and you can access it on the website on that screen. I've opened this. This is a screenshot, which is open to the discussion on diabetes. But I'm not sure whether I got to this, but we talked about the conversation you're having with your patient. And just because it's a long conversation doesn't necessarily mean it's good, or if it's short doesn't mean it's necessarily ineffective. And what this program breaks the conversation down into 1 minute, 5 minute or more minute chunks to help you have that positive impact. And so that when you go to the screen, and you might open this with your patient in front of you, because it drops down to, as you can see here, the 1 minute conversation or a 5 minute conversation. And you can go into whatever specific condition is relevant to that patient. It brings up a couple of sentences and pointers that you can have with the patient and help you with that discussion. I want to go on and talk about trackers and fitness trackers and apps. And we know that those fitness apps are effective in boosting physical activity. It's even helped and enhanced if they're personalised or with text messaging, and if there are rewards programs such as the Vitality program. And our app is going to be linked with a rewards program. And we think that that may be of great benefit to improving physical activity in disadvantaged communities. But we're going to begin some piloting work with GPs in our PHN to see how effective it can be. When you get your patient to be involved, you show them to download that Active Geelong app to meet the weekly physical activity goals and get a play on the game board and get rewarded with badges and discounts and vouchers. And when they log in, this is what it's going to look like. And it does relate to your Fitbits and whatever other tool you might use. And then there will be rewards. At the moment, they will be more lottery-based rewards until we can build up some collaboration with other people, organisations who may be able to offer us rewards. And it's a low-cost initiative, and we don't have great financial resources, so we have to look at a minimal approach in this area. I want to talk about GP walking programs, and here we have Dr. Kathy Turner from Lara Medical Centre and her initiative some years ago to get her patients walking and her own walking program. And we adopted that concept through our GP group, and we're about to roll out those walking programs in March and April of last year when the pandemic hit and we had to stop. And we hope to re-energise those later this year, and we will have a rewards option for that. Why walking? We know it's low cost and effective. There's accessibility for everybody, and it's convenient, and it has proven benefits. The obvious solution, if the GP advice, as I've said earlier, was the most effective to promote physical activity, and walking programs are effective, then bring them together, and GPs undertaking walking programs for their least active patients can be really effective. Patients like it because it's safe. They'll be walking with their doctor or their clinic nurse or a receptionist, and they feel that that program will be much more likely to get them involved than if they were to try and do it on their own. So how do you begin this conversation? We know that some activity is better than none, and start small and build gradually. find a companion or walk with your dog. But this added concept of exercise snacking, so you can encourage your patients that they don't have to do it all in one 30-minute slab if it's not possible. They can do it in snacks or little small bites, 5 to 10 minutes over a few times over the day builds it up. Walk to the local shop, park a bit further when you go to the supermarket and carry the groceries instead of using a trolley. All of those things add up to your daily exercise hit. Who are your partners in prevention for physical activity? We heard from Alison today about the role of nurses, and our GP clinic nurses can play a vital role, particularly encouraging your patients when they spend time with them preparing the management plans. And they too may be able to use that moving medicine app. You can refer to exercise physiologists and physiotherapists. The community health centres run great programs, but there are also programs held in local church halls and community halls run by a variety of people in our community. And our council-run gyms and pools also have good programs. So develop your own list at your clinic that you can then readily refer to when you're having this discussion with your patient. So I have an invitation for you. We welcome you to join our GP Activita Ambassador Group. Don't have to be just in Geelong, because we'll be having virtual meetings when we begin again, when our focus on vaccinating people starts to get to more business as usual, and we've got more time to spend back on these preventative initiatives. So we'll be having some virtual meetings, so they'll be open to GPs across the Western Victorian PHN. We'll encourage you to create your clinic's GP walking group, and there will be a rewards-based program, and certainly to start with for the Geelong area. We'll be encouraging to offer your patients the Get Active app and get them to use the app, which will give you some feedback on their compliance with what you're suggesting. And we'll be running some moving medicine workshops to help people use that tool. But if anyone has a desire to take up some of these other initiatives that I've mentioned, please feel free to contact me before the invitations might roll out for these various things which will go out, various activities which will go out through the PHN. So in summary, those steps to prescribing physical activity. Make it a high priority for every consultation with physical activity as a vital sign. When you're discussing the importance, use the Moving Medicine app to aid that discussion, and you will be able to in the future access it via health pathways. Identify the barriers and facilitators. We'll use those motivational and interviewing techniques. Exclude the contraindications, but develop an acceptable plan. Use Active Geelong website for your local activity options, or create your own go-to list. Use the Active Geelong Rewards app and start your own GP clinic walking program, and follow up to see how patients are going. And in conclusion, our patients should be encouraged to meet the recommended physical activity guidelines to prevent chronic disease and manage a number of chronic conditions. And to aid the established knowledge, there's increasing evidence that physical activity can improve the management of chronic pain, mental health conditions, inflammatory conditions and infections, and may in fact improve their response to vaccination. Our GPs are central to increasing physical activity in our community, and there are now new tools available to assist with GPs, as I've outlined, and new initiatives to upskill GPs and provide programs to assist you all will be promoted locally in July and August this year. Thank you very much for your attention. I'm sorry we had a little hiccup in the middle of it all, but I look forward to having some questions now.
Well, Hugh, we don't have a lot of time for questions, but thank you so much for that really inspiring talk. You got one of the delegates on a walker. through the talk, and I did a few squats. But I think it's just watch this space. I think we all need to connect with it. It's so important. So yes, we've only got 3 minutes, so I'll try and get through as much as I can. I think the first question from Michael Homewood was saying is, are there any cardio risk assessment tools that include exercise? And there was a few, someone else said that in the new risk tool it is there. I noticed in response, the Oz risks tool does include that. So someone has actually answered that in questions. So there you go.
Thanks for answering that.
So Anonymous asks, are the reductions in depression, anxiety with exercise the same in adults as adolescents?
So could you say that again, Anne?
It's the same risk, change in anxiety with adults and adolescents. Is it the same?
I can't specifically comment on that. I think the research has mainly been with adults, so I'm not across research for youth in that area, but I would suspect it has good crossover. Right, okay. I'm looking up some of the questions myself now, so we'll see how we go here. I'm having struggled scrolling down.
Hello, I'm back.
Oh, good. I can't scroll down on the questions.
So we've got 36 seconds, so we won't have much time.
That's all right.
Well, I think the main thing I want to tell thank you so much again, Hugh, and just remind everyone to fill in your evaluation. That gives you points for the prize. But I think we're all really inspired to talk to our patients about physical exercise, and I think the GP walking group's such a great idea.
It is, and we did find that hard to GP clinics find it hard to resource, but we'll be working to help with some ideas, and there is some funding from the PHN to assist us.
Okay, that's great. All right,
We can send the questions to Hugh to answer.
We can send the questions to Hugh if there's, and he can answer.